Abortion is the termination of pregnancy. This topic has been viewed by a scientific and religious standpoint, resulting in a debate on whether it is moral or not. However, there are many factors for a woman to even decide to get an abortion. In a typical setting, abortions are done as a surgical procedure which has many clear side effects. Shortly after the procedure, the woman could experience abdominal pain, nausea, vomiting, diarrhea, or even bleeding. These all cause discomfort and eventually can lead to more severe problems such as infection, damage to the cervix or other organs, hemorrhaging, or even death. All of these serious complications are twice as likely during the third trimester abortions than earlier abortions, making it even harder for the mother to consent to the procedure. However, the more severe problems are psychological. According to a research in Finland, people who had abortions the year prior to their deaths were 60% more likely to die of natural causes and seven times more likely to die from suicide. This was supported by the women of Denmark, who had a similar result. Along with these potential risks to women, it is hard to find a doctor to perform these late-term abortions.
Standing in the middle of the crosswalk.
Less easy to shrug off is the threat of physical violence. Among the protesters, clinic workers point out Roy McMillan.
Mommy, I have a dream, Mommy.
Who once signed a petition urging jurors to consider the killing of an abortion doctor justifiable homicide.
Doctors who provide abortions have been killed.
This is true. Frightened, sometimes yes. Paralyzed by fear, no.
This is true. There are many abortion doctors who are attacked simply for the assistance in the abortion, especially late-term abortions. As a result, many mothers are persuaded out of late-term abortions because of how it is viewed from others and the potential risk it could entail. This shame has silenced women who want to get an abortion, not even asking them for the reason of why they are trying to get an abortion. Researchers found that about 40% of women mentioned financial problems, where the child would most likely end up in an orphanage if it was born. This is because with a large amount of the world's population being below the poverty line and babies costing about $12,500 per year, it would simply result in the family going deeper into poverty. Furthermore, the cost to deliver a baby can also be too high for some families, as it can cost from $3,296 to $37,227. Think about a female who is about 18 to 24 that goes to Penn State. At their stage in their life, they cannot support a child, and it is caused by rape or by mistake. Most people would take that position that she should not have to carry out the pregnancy. However, in the 1992 case, Planned Parenthood versus Casey, they stated how there could be laws on the matter of abortion as long as they do not place an undue burden. These rules are so vague, though, that it has allowed people to outlaw or regulate abortion through trap laws or targeted regulation of abortion providers, stating how that they are doing it for the woman's well-being. However, this forces the woman to take care of the child even if she cannot economically or physically support him. Women take these risks for reasons. The question is, should women be allowed to make this choice on their own if they believe the outcome if they do not would be worse? You decide.